Virtual people, come on in, get cozy. Hope you let your pets out and turned your TV back off or jumped out of the ALKtALK Zoom room and joined us. Remember, everybody, whether you are at home or whether you are here, grab your devices, your phones, or an iPad or laptop, because this next session is interactive and we want to hear your voice. We hope you all are enjoying your morning so far. And again, you're gaining all of this information, and as we all know, knowledge is power, but what do you do with this knowledge? How do you make sure that it is being heard? So let's talk about that. Get your devices out, set them to the side, and we will be using them in a moment. Hopefully I can figure out how to move these slides, I think. We'll see. Okay. Everybody in. Great. The doors are closing. Let's get started. Okay. No, I don't want that. Back to the first one. Okay, it's coming. Okay, yes, that is perfect. Okay. So today this panel is looking at navigating cancer together. The power of shared decisions. Okay, let's go, maybe. Here we go. Okay, grab those devices. And you can either scan this QR code, I tried it, it does work, or you can go to menti.com and enter code 46408831. Take a picture of this screen if you want, but this code will come up again. You are going to use this site throughout the entire session, okay? So keep that open. You're not doing anything with it now, but grab that because you're going to be needing it. All right, everybody good? Got those numbers? If not, it'll pop back up again. Okay, now, hold on. Here we go. So why are we here? The objectives of our panel. We want to demonstrate the value of shared decision-making for clinical outcomes and the patient experience. We hope to foster empathy and understanding between patients and healthcare providers. And finally, we want to empower patients and providers to improve communication and collaboration. And who is joining me here today? So I am Summer Farmen, ALK Positive patient since 2020. And with me on this panel is the fabulous Michelle Monroe, joining us from Northwestern Medicine, where she is a nurse practitioner. Also up here is my ALK Positive sister, Katie Wright. And finally, I don't know if you know this guy on the end, we have Dr. Ross Camage back on stage, an oncologist at UC Health. Woohoo! So, shared decision-making across the ALK positive cancer care pathway. Shared decision-making between patients and their care teams is a vital part of your healthcare plan. Why, you might ask? Well, shared decision-making for sure increases patient satisfaction, right? You want to be heard. It establishes trust. It then builds on that trust. Shared decision-making increases the understanding of the risks and the benefits of the treatment options you are examining. Oh, what exactly is shared decision-making, you might say? Shared decision-making is a partnership between patients and their care team, working together to establish a practical care plan. Shared decision-making is the care team and the patient looking at the patient as a unique individual, taking into consideration a variety of factors, right? Their medical status, for sure, but what else is important to that patient? You're also looking at their emotional health, their goals, what's going on at home. And together, the patient and the clinicians are, again, making a sustainable and feasible plan of action. So, grab your devices. Everybody, are you ready? Were you following the directions? Of course! Okay. In just 1 or 2 words, what does shared decision making mean to you? And watch how cool this is. Go right ahead. Katie, can you start us off while they're answering at home? What does shared decision making mean to you?
To me, shared decision making means that everyone who's part of the team has the information that they need. As a patient, I felt very much in the dark at times, or overwhelmed at times, and being part of a strong shared decision-making team is just making sure that I have the information, I understand the information, and then you help me know what to do with the information.
Love that. And exactly what you're saying. It's teamwork, it's empowerment, it's confidence, all of those. I totally agree. Also, I would love if this little timer was working up here. Anybody? I really have that in my notes. Anyway. Okay, that's great. Let's move on to poll number 2. Thank you. You're doing amazing participation. And how cool is it that it's people from around the world giving us this input and this feedback, as well as all of you here. So again, we're stronger together, kids. How much do you feel you can currently participate in shared decision making for your ALK positive cancer care? Let's get a baseline at the beginning of this panel and see how comfortable are you right now with shared decision making. Okay, this is looking pretty solid, and this is great. And hopefully this will just continue to grow. But 4.3, I love to see that. Let's start with some questions from our panelists. Dr. Kamich, let's start with you. How do you approach shared decision making?
So I was talking to somebody in the break, and one of the things that always frustrates me when I'm kind of training junior doctors is they go to medical school as a human being, and then they come out at the end of it and they've forgotten that they were a human being, and they've learned this new language but forgotten the old language. So I think you always have to remember that the person in front of you, speaking as a physician, is the same as you, but just doesn't have that, specialist medical language. And so the key thing is not to show how incredibly intelligent I am and talk about Kaplan-Meier curves
but you
and
are.
three-letter acronyms, but to communicate. And that, I try and use humor, I try and use, being informal to try and level the playing field so that they feel comfortable asking me questions.
Those are great points. Now, how do you carry that approach over with your colleagues? Do you try to give a little nudge? Do you feel like you see that approach being used?
Well, I think I do. And again, you sometimes see these, I had one particular fellow from Australia who was incredibly funny, incredibly nice guy, but then he would go into this room and he would suddenly become rather stiff and awkward. And it's like, you just need to be the person you are outside the room, inside the room. And so you try and, give positive feedback and, occasionally point out that was a total screw up, but hopefully not too often. And again, we'll get into this with Michelle, but when we have nurse practitioners, advanced practice, I don't want them ever to feel like, they're the second choice in terms of who the patient sees. And so I will, if I see a new patient, I'll bring the nurse practitioner into the room. I'll explain that they're a member of the team. I'll often, ask them questions, and they'll see that we interact and communicate to try and emphasize that.
That is great. Thank you so much. And I think that's why we all appreciate you, that you do let that humor in. And we're all humans in this together, right? So thank you for that. Katie, you have a great story. Or interesting. Will you share with us your experience with shared decision making, please?
Sure. I had 2 very distinct experiences when I was first diagnosed. So as we all know, being first diagnosed, it is just like a minefield. Everything's going off. You have no idea. I mean, I shouldn't be trusted to sign papers. It was just the craziest moment, a few weeks of my life. And the initial oncologist that I had been working with, when we found out that I was ALK positive, she called to share the news that I was ALK positive and then just said, and this is what we're going to do. And it was, I didn't know at that point that there were options. I didn't know anything about what being ALK positive meant. And I was just told, this is the treatment that you're going to be on, and that's what we're going to start you on. I'm going to call in the prescription. And thankfully, I had already thought ahead and scheduled a second opinion And when I went to meet with my second opinion oncologist, she sat me down with the whole team, and we talked about that at that time there were 3 first-line options. Here are the positives and negatives of each option. Here is how they might fit into your life. Here are the side effects that some people have. And I didn't even know that these things were possibilities for me.
That's so great that you did then realize, like, okay, I have options, and how fortunate you were, and you had set up the second opinion. That's amazing. We always encourage that. Now, what does your care team look like today with shared decision making, especially with your nursing, with your nurse practitioners?
So Michelle is actually my nurse practitioner.
We have a real life care team up here, everybody.
The fix is in. The fix is in.
So my care team now is my oncologist kind of leads the way. And I work with the nurses. The nurses are really, and Michelle are really my first line of defense. Like when I have a question, they're really the ones that I'm going to first to ask about, to ask for clarification, to get any kind of information like that. It's really the nurses and my nurse practitioner who are kind of the backbone of our care team, I would say.
I love that. And that is such an important point that often we just are like, I just want to see my oncologist. Why did they put me with my nurse practitioner? But they are such knowledgeable and invaluable partners in our care and can bring in other insight. So don't shut them out. Embrace them. And Michelle, also we know that shared decision making is not just that initial decision. We have lots of decisions along the way to make. So how do you keep your patients engaged to be sure that they are active participants in their care?
So as an advanced care provider, it's very important to build this trusting relationship because we're going to be on this patient's care team throughout their journey. So what Dr. Kamich had said, it's very important, if able, that we can meet the patients upon those first initial visits or like a joint visit with the oncologist. The patient needs to feel comfortable and confident that, they're, talking about their symptoms and their life to us, who is part of their care team. So we often, help with triaging symptoms, symptom management, making decisions, on if they're going to hold treatment or take a little treatment break, but also help with coordination of care throughout the healthcare system.
Well, thank you on behalf of all of us for being an active listener, especially to those side effects, because I know many of you would raise your hands and say sometimes you feel not heard or that those side effects are brushed aside. So thank you. That is a great point. Okay, are you ready to have a little fun? In case you're not having a ball already. Here we go. Walking in each other's shoes, a role reversal exercise on shared decision making. Okay, we know that with treatment decisions, there are many different approaches, and there are also challenges along the way. The merging of your provider's point of view with maybe patient expectations and patient desires. So how do we meet in the middle? Let me introduce you to my actors. Up here, we have patient Katie Wright. Today, she will be playing Dr. Wright. Also, on the end, we have Dr. Kamich playing patient David Ross Kamich. Take it away, you two.
Hello, Dave. Let's discuss what we should do for your lung cancer.
Thank you, Doctor. I saw I was ALK positive, so I Googled it, and it looks like I have several drugs to choose from. Honestly, I'm a bit overwhelmed. I want to make sure I make the right choice.
Well, your primary consideration should be progression-free survival, where we'll look at something called the hazard ratio and the Kaplan-Meier curves in phase 3 studies. Overall survival is a bit harder to interpret because of crossover. We also want to look at the different rates of graded adverse events.
Okay, I didn't really follow all of that. What works the best, and are there side effects?
Well, none of the treatments are a cure, but you can use some drugs sequentially, and maybe that's important when we think about the AEs. One of the AEs you could experience is weight gain. But, if you're mindful of what you eat and you exercise, that shouldn't be a problem for you. Other AEs of some treatments could be brain fog or sun sensitivity.
That all sounds pretty scary. What are AEs?
Yeah, I don't think we have time to go through it. We have about 15 minutes, and I've got another appointment after you. But AEs are what doctors abbreviate adverse events as, so it just means side effects. I'll print off the information on the different choices, and then I can just tell you what I would choose.
Okay, I'm trying to figure out what is most important to go over in the limited time. I don't want any extreme side effects, but I'm willing to try. My partner said I should try and deal with more extreme side effects to have better disease control. How do I take the treatment?
Well, your partner said maybe something to consider. I mean, sometimes you do have to listen to your partner. In terms of route of administration, all of the treatments are taken orally.
I mean, that's a lot to think about.
Indeed, that is a lot to think about. But as you have terminal cancer, you probably want to decide pretty quickly. I think we should start you on my favorite, which is...
And scene. Woo. So that was a fabulous mess. What do y'all think? Grab your phones, grab your devices at home, get ready. And again, if you did lose this, you're at menti.com, code 4640-8831. What else might be going through the patient's mind that he has not communicated to the doctor? So please participate in that. Let's see what y'all think here. Oh my goodness. She was clearly out of time. Okay, great job. Right, confusion, panic, tiny bit. Those were definitely overwhelming. I love this. Excuse me? We're all a little traumatized by the, oh my gosh, I have cancer and I'm going to gain weight. I need a new doctor. Exactly. These are all so great. Good job. Keep them coming. Okay, are you ready? Thank you all for this participation. This is so much fun. Next question, get ready. What could the doctor have done differently? What could the doctor have not done differently? What could the doctor have done differently to help the patient feel more comfortable and more supported in making a decision about his treatment? Dr. Kamich, while they do this, can you tell us what was it like to play the patient?
Well, this may surprise you, but doctors are human beings, and we have been patients before. I remember vividly turning 50 and having a colonoscopy, and they treated me like a piece of meat. They didn't ask my name, they didn't ask me what I did for a living, even though I was in the same hospital I work in, and it was a rather demeaning experience.
Absolutely. Thank you for sharing those personal
Anytime.
information.
We have no embarrassment here.
Been there.
I have pictures. No. Yeah.
Cue the pictures, please. Okay, Michelle, as you watched this fabulous acting up here, did any of this resonate? Do you feel like you see this in your clinic, or?
Fortunately, I don't really see this interaction in clinic, but it does highlight that many patients do not fully understand the visits with their oncologist, whether they're using medical terminology, whether they're a little bit rushed on time and the patient needs a lot more time to think about it. And also too, patients are still kind of grasping their cancer diagnosis and not really fully hearing past, like, you have lung cancer. So those subsequent visits are really helpful to kind of refocus and really see where they're at in knowing what their diagnosis is and what their treatment options are or what they've decided on.
That is excellent. Thank you. I was going to say, how do you get them back on track after an incident like that? But yeah, that listening again and educating, I think, is
Asking
key.
open-ended questions like, what do you know about your diagnosis from your previous conversations with your oncologist?
I love that. Thank you. Okay, so now let's buckle up. We have more in store. Okay, again, let me bring back the actors. Let me remind you, we have patient Katie Wright playing Dr. Wright, and we have Dr. Camage playing patient David Ross Camage. Let's keep our fingers crossed for maybe a more preferred example of shared decision making. Take it away.
Hi, Dr. Wright.
Hi, Mr. Camage. Can I call you David?
Actually, I go by my middle name, Ross.
That is good to know. I'll make a note of that. How are you doing today? We've now got all the information we need from the molecular results to discuss the different treatment options for managing your lung cancer, and I'm here to help you navigate this.
Well, thank you, Dr. Wright. I saw the cancer was ALK positive, and I Googled it, and it looks like I have several drugs to choose from. Okay, there are a few things that are really important to me when considering my treatment.
Absolutely. What are your upfront concerns?
Well, I've read about the different ALK inhibitors available, and I understand that each comes with its own set of benefits and risks. Since I might be on this medication for years, fingers crossed, I want to make sure that we find the right balance between making sure it works and the side effects.
That is a really sensible approach. The process of choosing the correct treatment can be challenging, but today our goal is to find a treatment plan that is right for you right now. We can work together to figure out the right balance between disease control, safety, and how it will fit into your daily life. What specific factors are you looking to prioritize?
Well, I obviously want to live longer. That's the top priority for me. But I also don't want to have my life disrupted by some of the side effects and not enjoy that life.
I understand. We're going to do everything we can to find the treatment that can make your quality of life a top priority. The good news is that although we do not have a cure, as in take medication and stop when there's no more disease, all of the treatment options we will discuss can control the disease pretty well, usually for many years and sometimes longer than the averages, and not everyone gets every side effect.
Well, thanks for explaining it more thoroughly. That makes it easier to understand about what I can get from the treatment. What I'm concerned about is what the treatment will do to me. I don't want side effects to affect me and my life. I'm a dad, and I want to enjoy my time with my kids as normally as possible. I also work full time, so it's important that I can keep my job. The side effects shouldn't compromise that.
We can look at what options have milder side effects while still maintaining good disease control, or look at trying the better controlling drugs with more side effects and just seeing how you go. We can also play around a little with the dose when we start you on and escalate the dose as you tolerate it. Also, if any drug choice doesn't work as well as we hoped, you should know that we have options and other paths that we can take together.
That would be great. Thank you, Dr. Wright.
Let's discuss this at our next appointment, and you can bring your partner or a friend to help support you. We'll take all the different factors into account and work together to choose the best treatment option for you.
And cut. Phew! Well, that was a breath of fresh air, right? And I bet, again, in a situation similar to this open dialogue, because it, again, shared decision making isn't just at the onset, it's when you come back from a conference, right? And you're like, wait a second, can we talk about a couple things I just learned at the ALK Positive Summit? Or, hey, have you heard about that trial? So again, keeping that open dialogue and establishing those relationships and building the trust is so key. But don't take my word for it. Let's see what you all thought. So grab your devices. In a few words, what did you like about this second interaction that led to shared decision making? And how about our panel? What did you all like? Dr. Camage?
I mean, it felt much less rushed, much less hurried. I think you're a great doctor, Dr. Wright.
Thank you. Although I do like to tell people what to do sometimes. The second one obviously just felt just like a partnership, not a top-down directive.
Absolutely. Michelle, do you want to comment?
I felt like it was more towards focusing on the patient and really giving them time to grasp this new diagnosis and not rushing them.
Absolutely. I concur. I would definitely visit personality B versus personality A. So, and it looks like many of you agree. The listening, I think, is key, right? We definitely look for that, and the human side of our physicians. So that was amazing. The compassion, it seems like you at home, the supportive, the patient was heard and respected totally. I love that. Okay, one more question, please. Did the role reversing exercise change your perspective about how you can have conversations with your doctor? Did this make a difference for you at all? Let's take a look. That's great to see. And I'm taking some of those no's as I'm pretty solid. I'm already have an existing shared decision-making partnership, so that is amazing and so good to see. And yes, hopefully that empowered many of you to remember that, okay, I do have this voice, because again, we know that this is not a linear path for us, and there are going to be peaks and valleys, which we will talk about. Okay, let's move along here. Pathways to partnership. What does good shared decision making look like? And as I just gave that sneak peek, for sure, it is, for many of us that are stage 4, I always say, it's not if I progress, it's when I progress. And we could be riding along, our hair blowing in the wind, and then we hit that valley. So again, that's why that partnership is critical. And we have, let's talk about real life. We have physicians that retire. We have new specialists that come onto our care team. So establishing that trust, building that, facilitating an open form of communication from the beginning is imperative. Or make the changes now that you need to. Okay, Katie, you talked earlier about your shared decision-making experience. What advice would you give to patients and care partners to help them be confident in speaking?
I think my best piece of advice would be write down questions that you have so to make sure you get answers so that you walk away from your appointment knowing that the big things that were on your mind were covered.
Absolutely. And that's what I was thinking here. I saw a little hand go up during one of the first panels, and I almost slipped him a note and said, write those down, because, for example, we'll have Ask the Experts soon. Mm-hmm. And that's what you do kind of when you go to your appointments. You're asking the experts, but okay, pat yourself on the back. Many of you are also experts too, as patients and care partners. But write those things down, those questions down, share ALK talks or what other information that you learn. Katie, that is great advice. And Michelle, again, you touched on this earlier, but how do you empower patients to keep that dialogue going and to be active partners?
So I'm always providing education at any time points of patient visits, making sure that they have correct resources specific to their diagnosis or specific to their treatment plans, but also actively listening to their concerns, whether it's during the visit or during a MyChart message, but encouraging the patient to always reach out, whether they think it's bothering us or whatnot, but just to let us know, oh, my legs are a little swollen. Is this normal? Is there anything I should do about it, or do I just deal with it? But always asking open-ended questions during the visits, because patients we want to be able to maintain quality of life and maintain what they're doing outside of our cancer clinic.
No, and we so appreciate those open-ended questions, because as one of our experts mentioned in that first panel, we are often reluctant to share our side effects, for example, that we're too scared, like they're gonna dose me down, or I am very, very guilty of that. So I appreciate that you're trying to, you have the trust and you're trying to pull that out of your patients. So that is great, and that active listening is key. Dr. Kamich, how about you?
So I want to go back to the recurring theme of doctors as humans. So I actually think almost all doctors want to be good communicators. And yet, you know, the stresses, the anxiety, and everything else that's going on in their day that you don't know about, they may bring into the room with them. But if you actually pluck up the courage and say, yeah, hold on, I don't think you're asking my questions, they will reset. Yes. They will go, I'm sorry, I totally screwed up. Okay, let's start again. And I would say it's a shock to them, but every time I've seen that done, then the doctor steps up to the plate.
That is actually great advice. I do think that we do need to remember that. Yes, that doctors are human, and I love that little reset tip. I'm gonna put that in my pocket. But that is true. Just like, wait, back up. Yes, that great advice. Okay, so hold on a second. Next steps. We want you again to continue to feel more confident. It seems like many of you already are. And we want to provide tools for you to take forward with you. If this didn't resonate today, it might in a few weeks. So again, this will live on our YouTube page eventually. And for those of you at home too, you might not need it right now, but down the road, that's for sure. Also, on our ALK Positive website, we do have questions to ask your doctor about your ALK Positive lung cancer. So that is there. Also, our ALK 101 series that is on YouTube, I believe it is session 2, talks about building your care team and again, how to maintain those working relationships. Again, it's a partnership, it's a collaboration. Also, you should have in front of you, you received during the break while our little ALK Positive elves ran around, a one-pager by Takeda, The Power of Shared Decisions. If you're like me and you might misplace that, take a picture of it, save it in your favorites so it will be there for a rainy day when you need that confidence boost to remind yourself the importance of shared decision making. And finally, ASCO has a great book, a great little education book that is not yet on our ALK Positive website, but will be there, on shared decision making in the care of patients with cancer. And I just want to highlight too that shared decision making is also informed decision making, right? It's not just going in blindly. It's being empowered with knowledge to make an informed decision. So it's multifaceted there. Does anybody have any closing remarks you might like to make? You've been a wealth of information and ideas already. So we are, Katie, did you have something?
No, I really think of it as my oncologist, like if we're all on the bus, I have my oncologist driving the bus, and I was a public school teacher for 20 years, so I'm like the teacher in charge of the field trip, and the rest of you are, you know, the seats on the bus, and I kind of guiding you where to go, but yeah.
That is
like
amazing.
that.
And also, remember the benefits of shared decision making too. The majority of us in here are laying in CT scans every 3 months. And we all know that whether you are 2 years in, this could be a shocker for those newly diagnosed, but whether you're 6 months in, whether you're 2 years in, whether you're 7 years in, the anxiety is still there. But it does get better when you are empowered with a plan of action. When you are laying in that bed and you're like, I've got this. Like, who knows what's gonna show up on these scans, but I've talked to my care team. I know what I'm going to do for plan A, B, and C. So even though, yes, of course, I'm personally laying there going benign, 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 but I'm also comforted by knowing that I have people who are going to listen to me and are ready to jump into action. So empower yourself, take all that you are learning this weekend. It is a lot of information, but again, that's why it's recorded. So you will have these resources to make these informed, shared decisions. So thank you to our fabulous panel today.